and welcome to UBS Trending. I'm your host, Ainsley Carbone. Turning 65 is a milestone for many individuals because it signals eligibility for Medicare. So for today's show, we'll cover the basics of enrolling in Medicare, such as who is eligible for it and when do you need to sign up. And we'll provide you with the steps you need to take to find and enroll in the right coverage for your personal situation. So today I'm joined by Emily Lau, Head of Wealth Planning Specialist, to discuss her new checklist from her team enrolling in Medicare. So Emily, thank you so much for joining us today.
It's my pleasure, Ainsley. It's a true pleasure to be here because I do think that this is an incredibly important topic for many of our clients.
Could not agree with you more. It's something that we always could be talking about because it is such a complex topic, and we do need to try to help them understand and simplify it. So to kick off the discussion today, Emily, can you provide us with a quick overview of what Medicare is?
Absolutely. Medicare is a federally run health insurance program, and it has several components that's denoted by the first couple letters of the alphabet, A through F, skipping over E. Part A is the hospital insurance, so it will cover services for inpatient hospital stays, hospice care, and certain skilled nursing facilities. It is generally premium-free, but not always. It is premium-free for those who have been paying into it through their working years through the FICA taxes. Part B is the doctor component of Medicare, so it covers doctor services, certain preventative services, and certain medical equipment. Part B, there is a monthly premium, which actually does go up as your income goes up. Keep in mind, income is not just income derived from working. It also includes income coming off of your investments. It also includes certain other types of income sources, for example, rental income. So in other words, the more you make, the more you pay. Part B does not cover prescriptions or drugs. And also, even with Part B, there are additional out-of-pocket costs. For drugs or prescriptions, it is covered by what's called Part D, as in drugs. Like Part B, there is a monthly premium that does go up with your income. It is issued by private insurers such as SilverScript or United Health. As I mentioned, Part B does not cover all costs, and there could be additional out-of-pocket costs. So to address that, many of our clients obtain what's called Part F, or Medicare Supplement, or what's also known as Medigap. So these are policies that are issued by private insurers. There's also a monthly premium associated with it. So one way that clients can address their medical concerns when they are eligible for Medicare is that they would be enrolled in A, B, D, as well as F. So you may be wondering, Ainsley, and those who are listening in from the audience, what about Part C? How come I skipped over that? So Part C is known as Medicare Advantage. Think of Medicare Advantage as an alternative to what I had just described in terms of being enrolled in all these different parts. So rather than being enrolled in A, B, D, and F, clients can choose to go and have all their healthcare services going through Part C or Medicare Advantage plans. So these bundle plans may have and can offer additional services that's not offered through the other parts, such as visual, hearing, as well as dental services. So to summarize, if you are eligible for Medicare, there are really two paths that you can take. The first one is you can be enrolled in A, B, D, and F. Or you can choose to have all your healthcare services being provided through Medicare Advantage or Part C. There are, of course, considerations for both paths, which is something that we'll be discussing at a later point in this conversation.
Certainly a lot of moving parts involved here, but thank you for covering that for us. So now that we know what Medicare is, can you tell us a little bit about who is eligible to enroll in Medicare?
To be eligible for Medicare, you do have to be 65 and up, or if you don't meet this age requirement, you can be eligible if you are disabled, and that is total disability as defined by Social Security, as in you cannot work, period. Or if you have what's called end-stage renal disease, or ALS, which is also known as Lou Gehrig's.
Okay, thank you. So for someone who is eligible because they're nearing age 65, when do you suggest they sign up for Medicare?
So in terms of signing up for Medicare, the initial enrollment period starts 3 months before you turn 65, and then it ends 3 months after you turn 65. So there's effectively a 7-month window that you can sign up for Medicare. And if you have started receiving Social Security benefits already, it is actually auto enrollment into Parts A and B. So in other words, you do not have to sign up. If that's not the case, then yes, you do have to sign up, and for that, you should be contacting the Social Security Administration. Once you've enrolled in A and B, it is at that point that you can enroll into a prescription plan, so that's Part D, and the Medigap plan, Part F, or you can decide to go and have all your services received through Part C, Medicare Advantage. Now, I'm going to emphasize this. It is incredibly important that you do not miss this window. If you do not sign up for Medicare when you are initially eligible to do so, you can be subjected to penalties when you sign up for it later on. And these penalties can be pretty substantial. So for example, Part B, there is a 10% penalty on the premium for every year that you were eligible for Medicare but did not sign up for it. And Part D, it's a 12%. Again, that's an annual premium increase. And this is something that you will continue to pay for as long as you're on Medicare. So again, I would just want to emphasize to the audience, for those who are tuning in today, that you want to make sure that you do sign up during the 7-month window. There is an exception, which is the good news. If you are still working and you are covered by a credible health care plan, so the credible health care plan is defined as having a health care plan through work, or if your spouse is still working and they're covered through work, that covers at least 20 employees, then you can delay signing up for Medicare. Other credible health plans would include if you work for the federal government, or perhaps you are covered by a union. In that case, you can delay taking Medicare and not be subjected to penalties when you do sign up for it at a later point. Once you are enrolled, you actually don't need to take action every year unless, of course, you want to change your plans. In which case, if you do want to make a change, you can do so during Medicare's annual enrollment period, which starts on October 15th and it goes to December 7th.
Thank you. So like I said before, so many moving parts. There are so many different plan options. So what are the considerations on deciding which Medicare plans you should enroll in?
Great question. While monthly premiums is certainly a factor, I do think that there are other factors that are just as important to take into consideration. So such factors can include if your existing doctors would take the plan of choice, would your pharmacies take the plan of choice as well? What out-of-pocket costs that you may have, even if you were to be enrolled into these plans, as well as any future health issues that you may have. So as I mentioned, when we first started this discussion, I had talked about the 2 different paths. So again, for our audience, as a recap, the pathway 1 is enrolling in A, B, a prescription plan, as well as a Medigap plan, or getting everything through Part C, Medicare Advantage. So at first, that's very appealing. Less moving parts, as well as generally Part C has lower premiums overall. However, Medicare Advantage plans do have more restrictions when it comes to doctors and hospitals and what's available to you. So that's a very important consideration, as well as, of course, you may need additional authorization for certain types of treatment. So these are factors that should be taken into consideration. And while you can change plans during the annual enrollment period, insurance companies may require that you go through underwriting, which is the insurance company's process that they use to determine whether or not they want to take you on. And so you may be turned down for coverage at a later point. So it's very important that when you initially enroll into it, you take into consideration any potential future healthcare issues. So knowing your family history is a great way of starting. Then lastly, just keep in mind that Medicare does not cover long-term care. So it's very important that you also plan ahead in order to address this issue.
That's a very good point. I think that's a really common misconception that a lot of people find themselves thinking that Medicare is going to cover some of the costs of long-term care services, when in fact they might not cover any, and if they do, it's just a very small portion of those costs. So certainly important to think about there. Now, really quickly, for someone who is eligible for Medicare and they're nearing age 65, what are the next steps that you'd suggest that they take to enroll in that Medicare?
I have a few steps that I would suggest everybody to pay attention to. The first one is start by confirming deadlines that you may be subjected to on Medicare.gov, just to ensure that you don't miss it. Secondly, speak with your doctor's office. Talk to your pharmacies to see what Medicare plans that they do accept. You can then review and compare the plans that's available in your state on Medicare.gov, or you can actually work with a Medicare agent to identify the right plans for you. Don't forget to speak with your financial advisor in order to incorporate your healthcare costs into your financial plan. Your financial advisor can also help you strategize on how to best address this cost going forward. In conclusion, Medicare is complex. And so for those tuning in today, here at UBS, we have the tools to help you get through and navigate these complexities. Reach out to your financial advisor today to get started.
Thank you, Emily, and thank you so much for joining us today.
It's my pleasure.
Nice to see you. Thank you, everybody, for joining me. For more information, visit our website at ubs.com/views. Follow UBS on social media, LinkedIn, Facebook, Instagram, Twitter, and check out past UBS Trending episodes on demand. And as always, if you have any questions about your portfolio, please speak with your financial advisor. Until next time, I'm Ainsley Carbone. Have a great day, and remember to keep your eyes on what's trending.